here today advocating for the nurses that work for Baystate Home Health and all of the hard work they've been doing, taking care of patients on the front line during this pandemic and prior to and hopefully after this pandemic is all over.
What we're trying to do as nurses is to have strong contracts so the nurses can provide quality care to the patients and not have such a high turnaround of new nurses coming through. We need the expertise to treat these patients in the home. They're coming home sicker.
Negotiations have been difficult. There's been a lot of proposed takeaways. Right now, the union nurses have a sick bank and they have a vacation bank. So what they're proposing is to put it in an ETO bank, which means that we would get less of sick and vacation time than we do right now. We are putting ourselves at risk, we're putting our families at risk by taking care of COVID patients. And if we become sick, and can't see patients, and if we end up having COVID or one of our family members gets COVID and we have to stay home, we have the right to our sick time that we have earned. There's been a lot of turnover, unfortunately, at Baystate Home Health. Nurses are tired, they are, stressed, there's been so much work piled onto us, and not just even during this pandemic, but even before. Right now, Baystate is releasing their COVID patients earlier. They're coming home to us to have home health nurses in their homes. Some people don't have family members that can care for them, and right now during a pandemic, they unless you live in the house with the patient, they don't have anybody. Some people don't have anybody to take care of them. So that's where we come in. So if we don't have a good contract, and if we're not, if Baystate doesn't take care of its nurses, who's going to take care of our patients?